Good afternoon, folks. Thank you for joining us on today's Healthy Community. I'm glad you can be with us, and we are welcoming you to talk about a health topic that is on the forefront of people's minds. I think a lot of people. Our show focuses on local, state, and national level perspectives that aim to improve health literacy by offering resources and information that strengthen the health of individuals, families, and the communities in which we live. Our show airs each Friday weekly at 12 noon, or you can download podcasts at www.gmcr.org under our tab Today's Healthy Community in the program section. Today we have the pleasure of welcoming Dr. Robert Rhyne and Miss Danelle Callan. And just to give you a brief introduction, Danelle received her master's in health economics, and she's a research manager working with Dr. Robert Rhyne. Dr. Robert Rhyne is a professor and vice chair. He is a medical doctor, but he's also a professor and vice chair for research in the Department of Family and Community Medicine at the University of New Mexico's School of Medicine. His medical doctorate is from the University of New Mexico. He did residency in family medicine at Duke University and completed a fellowship as a Robert Wood Johnson Clinical Scholar in Clinical Epidemiology at the University of North Carolina's School of Medicine. He co-founded RIOSNet, a primary care practice-based research network, in 1999 and is one of the co-directors. He has over 40 years of experience in primary care. And since '84, he's been funded with grant support for research, has been a primary investigator and co-investigator on multiple National Institute of Health and AHRQ-funded projects. He looks at health disparities, evidence-based medicine, translational practice-based research, and preventative medicine. His research topics included colorectal cancer screening on multi-ethnic populations, quality improvement in small practices with regards to cardiovascular care and cardiovascular prevention, and the treatment of chronic non-cancer pain, specifically with respect to opioid prescribing, which is opioids and alternatives is what we are going to be talking about today. He was a Fulbright Scholar in 2002 to 2003 and a visiting professor at Moscow Medical Academy in Russia, studying post-Soviet primary care systems and community health. He's also served as a consultant to a U.S. aid project in Russia, resolving public health problems through community and conducting workshops in community health development and strategic planning for the American International Health Alliance in 6 Russian cities. In 2004-2005, he was also the technical officer of a U.S. aid project to improve primary health care in Albania. So, wow, thank you so much, both of you, for joining us today. I know that the opioid crisis across our country is of concern, and I think, Dr. Rhyne, as a medical doctor, you certainly understand the blessings and the benefits of opioids in regards to pain management and alleviating discomfort in patients. But over time, we've also recognized that there are notable risks involved in the use of this medication. And I'm wondering, specific to New Mexico, since we're talking to a lot of listeners here in the Southwest, but also across the country, can you talk to me a little bit about what the opioid crisis looks like?
Certainly. Thank you for having us today. We really enjoy the invitation of being on your show, Rebekka. Basically, the opioid crisis that we're currently dealing with really is a problem of opioid overdose deaths. Those have continued to increase in all regions of the United States, in both men and women, most age groups. It has really increased over the last 2 decades, with deaths from overdoses tripling between 1999 and 2016. And what we like to concentrate on is what is the evidence. That's sort of what we're all about here. Heroin has increased among men and women, age groups, and it really now is a problem of all income levels and all arms of the society. The strongest risk factor for heroin use is really prescription opioid dependence. So we have some statistics, if you're interested, in terms of the general U.S., and then down to New Mexico. Can I go ahead with
please.
those?
I love data, yeah.
Okay, good. First, the opioid death epidemic. Overdose deaths from drugs are now the leading cause of injury death in the United States. Over 2 million Americans have opiate use disorder, which is basically addiction to opioids, narcotics.
Mm-hmm.
And many switch from prescription opioids to illegal heroin because it's less cost and it's more accessible. Now on to prescription opioids. Prescription opioids have quadrupled in the United States since 1999, the number of them. The amount of reported pain, however, has stayed the same. A 2011 Institute of Medicine report cited that 116 million people in the United States have some type of chronic non-cancer pain. So that means that a third of the people you see walking around the street has some type of chronic pain. 40 people die every day from an accidental overdose from a prescription with narcotics.
So this is an epidemic.
We've had 165,000 deaths due to this since 1999. An amazing problem.
It is a huge problem, and I think that we can go look at the different facets of chronic pain and what actually causes it, everything from diet to lifestyle. But we come back to this issue with opioids. And I know that you work closely with the state and federal governments, working with the NIH and folks around the state. What's their take on it? What do you think they want to do about it?
Well, let me first tell you about New Mexico.
Oh, yes,
and then
please.
We'll turn it over to Danelle, and she can tell you about what's happening in the state.
Yeah, New Mexico would be interesting. Give us those statistics.
New Mexico, we used to be number one. We're number one in a lot of bad things, health-wise, but we used to be number one in accidental prescription overdose deaths. We're now number 8 to 13, depending on which year you look, and our rates haven't changed much. Actually, it's just that states in the east and the northeast have increased. Actually, the drug overdose death rate in New Mexico in 2016 was about 25 per 100,000, which equates to about 520 deaths per year in New Mexico alone.
That's almost 2 people a day.
Yeah, that's true. In 2016, there were 1.7 million prescriptions for opioids written in the state of New Mexico.
Gosh.
The highest age group is in 25 to 64-year-olds, and in the age group up to 45, men are more prevalent than women. And then the gap narrows in terms of accidental overdose deaths. At age 55, females have more accidental overdose deaths than males, from 55 to 64. Now here's some interesting data for your area. If you look at the number of accidental overdose deaths in New Mexico, Catron County is number 2, Hidalgo County is number 7, Grant County is number 8, and Luna County is number 27, and of course that's out of 33 counties in New Mexico.
Mm-hmm. So there's definitely room for improvement.
Danelle now, and she'll talk to you about what's going on in the state.
Thank you. Thank you, Danelle, for joining us today. So give us a brief snapshot about what the state's looking at and what you're looking at doing.
So nationally, there's been a lot of funding coming out over the probably past five years or so, looking at the opiate epidemic. And specifically here in our state, there are numerous programs here at the university and also numerous programs across the state with grant funding looking at different aspects of opiate use disorder, prescription, evidence-based education, and using community groups, organizations, and health councils to kind of target the different problems in this multifaceted approach they're looking at to try to bring our numbers down. Currently within our projects here at the university, within family and community medicine, we're basically working with the state by attending, there's a New Mexico Prescription Drug Misuse and Overdose Prevention and Pain Management Advisory Council that meets almost monthly. and it's facilitated by Michael Landon at the Department of Health, and we kind of attend that, learn kind of what's going on here in the state, what the data looks like, and they also assist with some of the projects that we've been looking at. Currently, we've worked with the Department of Health over the past 2 years, providing academic detailing training, which is basically evidence-based information directly to providers at different clinics and clinical systems to assist with safe opiate prescribing and chronic non-cancer pain, and also providing free CMEs to meet the needs of the mandatory 5 pain-specific CME hours that most providers with DEA licenses in the state have to have.
Mm-hmm. Mm-hmm.
We also just started here, going on a second year for the state targeted response contracts, and in those contracts, we're looking now at expanding beyond just education and training for safe opiate prescribing, and looking at, again, continuing our technical assistance and education and training on safe opiate prescribing, but also looking at naloxone training and distribution within the Youth Detention Center here in Bernalillo County. And naloxone, in case you didn't know, is an opiate reversal drug that's used to assist people in reversing an opiate overdose.
Right.
And there's been a lot of projects here in the state looking at moving this beyond just prescribing and actually getting this in the hands of people when they pick up their prescription. They don't actually have to get the prescription from their doctor. There's standing orders at all pharmacies, so individuals can get naloxone just from their pharmacist and not having to see their primary care provider. And so that's one additional arm that we're doing. We're also looking at medication-assisted therapy, which is basically targeting those individuals who have been identified with opiate use disorder and providing medical-assisted therapy through buprenorphine and methadone to assist those individuals in overcoming their addiction and kind of getting back to their daily lives. And so we're going to be working the state targeted response on that and trying to work with providers on increasing the number of providers that have received the training, but also identifying what the barriers are in practice for those providers that get trained, actually implementing that in their practices, so that we have more of these type of providers and this type of expertise out in our communities.
Well, that's really, really exciting. Believe it or not, we're getting ready to take a station break, and I think that's going to really help us walk into the alternatives, and we've got some interesting information when we come back from our break. Stay tuned. Welcome back to today's Healthy Community. You're joining us here today with Dr. Robert Rhyne and Ms. Danelle Callan, and we're talking about opioid use and the opioid crisis, and this will help us kind of walk into the second half of the show. I understand that with the overdose and the number of folks becoming addicted to these opioids, a lot of providers are actually scared to prescribe this medication because they don't know how it's going to be used and what the ultimate outcome might be. And it looks like we may have some alternatives, and one of them I know that you've been doing research on is medical cannabis. And I'm wondering if we can talk a little bit about maybe what the evidence might be for medical cannabis. I know it's kind of been closeted, but I think that at least what I've seen, there seems to be reasonable and strong evidence that this could be a great alternative for a host of conditions.
Yes, that's true. The key these days is to find alternatives. You can't just stop treating people with pain because there's an epidemic of opioids. Some people need it, and some people can actually be taken off of them. And the evidence regarding medical cannabis comes from the National Academy of Sciences report put out last year in 2017. It's a 440-page report on the health effects of cannabis and cannabinoids. Basically, 28 states and the District of Columbia have legalized medical cannabis, and I can talk just a little bit about the major benefits and harms stated in that report. So on the benefit side, there are 3 conditions that they have conclusive evidence for the effectiveness of medical cannabis. One is in treating chronic pain in adults. 2 is as an anti-nausea medication for patients undergoing cancer chemotherapy. And 3 is for patients who have multiple sclerosis and also have muscle spasms from their MS. Those are the only 3 conditions that they stated that there is absolutely good conclusive evidence for effectiveness. There is moderate evidence, and what they did was looked at all these different conditions and rated the evidence behind them. There's moderate evidence that medical cannabis can improve short-term sleep in patients, especially with obstructive sleep apnea, fibromyalgia, chronic pain, and MS. All other conditions had limited, insufficient, or no evidence of benefit. So that's the benefits part. The harms part is that there was substantial evidence showing that if you smoke cannabis, it's associated with chronic bronchitis.
Sure.
There's good evidence showing that it increases, on an acute basis, motor vehicle accidents if you drive while you're impaired. It also leads to low birth weight babies in pregnant moms. And there is substantial evidence showing that it's associated with the development of schizophrenia and other psychoses.
Mm-hmm.
There's moderate evidence on harms showing that it does acutely impair cognitive learning, memory, and attention. So those are the basic findings. I can't go over everything because it's a 400-page report.
That was a great snapshot.
Major.
And I'm curious to see as we move forward with, now that I think research is becoming more common, if you will, for this particular medication, I think that I won't be surprised if we find that there are a myriad of other conditions that it could be helpful for. I'll be interested to see what kind of evidence they come up with. I've heard that it's been very helpful for folks with seizures. So this is a hopeful opportunity in regards to researching this medication a little bit better. Now, can you tell me, Danelle, a little bit about, some people may not be familiar with when Dr. Rhyne was talking about the 28 states and the District of Columbia who allow the legal use of medical marijuana. Here in our state, we have the Lynn and Aaron Compassionate Use Act. Can you talk a little bit about that and why it came to be and what it is?
So the Lynn and Aaron Compassionate Use Act basically allows for the beneficial use of medical cannabis within a regulated system for relieving symptoms caused by debilitating medical conditions. And this actually came about through a legislative measure versus a ballot vote, which is what's come up in other states like California. Our state actually has 21 qualifying conditions. The top 3 that people apply for here in the state is PTSD, chronic pain, and cancer. And currently we have 35 licensed nonprofit producers in the state that are growing and producing the medical cannabis, and those are getting sold at over 70 dispensaries here across the state. The main thing to know about our law, or at least our legislation around medical cannabis, is that the physicians themselves are not prescribing the medical cannabis. It was specifically written this way to protect providers.
Mm-hmm.
So as a physician, you are basically confirming that the patient has at least one of the 21 qualifying conditions and recommending them for the state program. And then it's the state that actually verifies all this information through their own internal processes, and then they send the medical cannabis card to the patient, and the patient works directly with the dispensaries to get the types of medical cannabis that they're looking for.
So I'm glad that you point that out, because I know that in our rural and frontier communities, of which 32 of our 33 counties are deemed rural or frontier, that we have lots of federally qualified health centers and community health centers. And I think that with the federal funding, there might have been some concern with providers about prescribing medical marijuana. I'm glad that you pointed that out, because yes, in the state of New Mexico, the provider, the healthcare professional, is just verifying the condition, and then the process goes to the state to get your card. And talk to me a little bit about, I think we have a unique opportunity here. First of all, I know that with the different products that are coming out, you don't have to smoke marijuana anymore. There are measured doses, just like you would take an aspirin. There are different products available with this medication. And you have a call to action, because we have an opportunity here in this corner of the state for patients to find out more about a project you're working on. Can you talk to me about the projects you have going on there?
Sure, I'll jump in on this. So, a couple of projects we have going on. I want to start with what led to these projects. We realized that physicians didn't know very much about this subject, and So the question is, how do patients decide what medical cannabis formulation, what dose, how frequency to use it for the products that they get, whether it's edible, oils, topical, smokable, whatever? How do they determine that? So that's the subject of our first research project. So we have a team that's going to look at that interface between patients, cannabis technicians, and providers and try to figure out how people decide what to take for their conditions, specifically chronic pain. We also want to know, there is some evidence nationwide showing that, and a couple of studies out of the university here, psychology department, showing that opioids can be reduced when using medical cannabis. So that's an important concept. But how does that work? So we're also addressing that issue, and that's the study that we just got funded. And when we're ready, we can post the number to call for participants on your website, Rebekka.
Absolutely.
And we can down and interview people in Silver City or in your area who may want to participate.
Yeah, I think that that's a wonderful opportunity for our listeners. If you've not liked us on Facebook, we encourage you to go on Facebook and join us and follow us on Today's Healthy Community. We give updates, provide information, we field questions. You can send us a message about topics you're interested in. The medical marijuana project that you're working on is interesting to me too, because as I'm learning more about it, I understand there's different kinds of marijuana, indicas, sativas, those kinds of things, and they work differently in the body depending on the condition and the symptoms that you're trying to address. And tell me a little bit more about what you're doing with the technicians and the providers. It sounds like patients here may be able to participate in this study.
Right. So what we're going to do with this study is we're going to interview people who have chronic pain and who have a certified medical cannabis card, and we're going to interview them regarding how they make the decision what to use. This is going to ultimately lead, hopefully, to a study that will look at what is the impact of medical cannabis on chronic pain and what is the impact on opiate use. And that's our ultimate goal, is to figure that out. You know, because it's a Schedule I substance and against the law federally, it's very hard to do research on this. There's only one standardized growing facility in the United States. That's in Mississippi, and It takes over 4 years to get a license to use that material. So we're going through the back door to try to figure out what the effectiveness of this is by using what we already have here in New Mexico. What is going to allow us to do that is that every product sold at every dispensary has to have a certified laboratory evaluation on what is the THC and CBD content of every product. So that's what we're going to use to figure out the dose.
Well, we're down to about a minute and a half here. You're doing a collaborative partnership between CASA, Dr. Tim Condon, who was on our show last week, and other partners. And can you tell us a little bit about that? And then we'll close. And I just want to remind folks that we'll be putting a phone number and contact information more about this episode on the Today's Healthy Community Facebook page. Go ahead, Dr. Rhyne.
Sure. We have formed a team, like a study team, to study this subject. And so this team will be doing all of the studies. It includes CASA with Tim Condon. It includes the Pain Center here at University of New Mexico, many, many different practices that we've worked with all around the state. So we will have this consistent team that will perform these studies over the next years.
And the feedback has got to be valuable, because you're going into all the different areas of the state and working with a variety of providers to really get a well-rounded view of what the outcomes and the evidence is.
That's right. We teach in every community around the state, and our educational program for physicians and providers with DEA licenses covers the entire state. So we'll go anywhere, meet with anybody at any time to provide this education.
Well, I'm going to remember you said that, because I think we have a lot of providers in this southwest corner of the state who might be able to benefit from your expertise and your feedback. So we're going to get ready to wrap up. Is there any closing remark you'd like to make here other than letting folks know that we're going to offer a phone number and contact information for this study here on the Today's Healthy Community Facebook page?
Yeah, I think that your comment earlier needs to be emphasized, and that is that all providers who prescribe opiates nowadays are under a lot of scrutiny. And please be patient with them and ask why they're deciding what they decide. And if they need education, let us know.
Okay, well, Danelle and Dr. Rhyne, thank you so much for joining us, folks. It's always a pleasure to have you every Friday from 12 to 12:30 on Today's Healthy Community. Join us next week, and until then, everybody, stay healthy.